Hello everyone. So our today's topic is von Willebrand's disease. So it is again a kind of coagulation disorder and it is an example of hereditary coagulation disorder. But the only difference is it's not X-linked disorder but it is autosomal in nature. So what is von Willebrand's disease? It affects men and women equally. As I've told you, it is not an X-linked disorder, it is autosomal in nature. And it is the most common inherited bleeding disorder in the United States. Most people who have von Willebrand's disease are born with it, but rare spontaneous mutations do happen. So that means these are mostly inherited and very rarely mutations occur. Most common inherited bleeding disorder. Symptoms can be mild, so people often go undiagnosed. Von Willebrand's disease affects all the races equally. So this is a small mnemonic for von Willebrand's disease, where V stands for von Willebrand's disease is, and the A in the W stands for autosomal, and D stands for dominant. So von Willebrand's disease is an autosomal dominant. So again, there are two types, qualitative and quantitative defect in the von Willebrand's factor, and it occurs in 1 in 1000 individuals of either sex. It comprises of factor VIII von Willebrand's factor complex. So this circulate together as a unit and perform clotting and facilitate platelet adhesion to collagen, but von Willebrand's factor differs from factor VIII in many ways. So these are a few differences between von Willebrand's factor and factor VIII. So von Willebrand's factor, the gene of it is located on chromosome 12 and thus it is autosomal in nature, whereas factor VIII gene is located on X chromosome and thus it is sex linked. Von Willebrand's factor is synthesized in endothelial cells, megakaryotes and platelets, whereas factor VIII, the principal site of synthesis is the liver. The main difference is between their function. So the function of von Willebrand's factor is adhesion of platelets to subendothelial collagen, whereas the function of factor VIII is activation of factor 10 in the intrinsic coagulation factor. So this is a pictorial representation about von Willebrand's disease, where this is the normal blood, where there is activated platelet and there is formation of clot and thus the bleeding stops. Whereas when there is von Willebrand's disease, there is not enough platelet adhesion to the subendothelial cells as it is the main function of von Willebrand's factor, and thus there is no clot formation and continuous bleeding. This again explains the same thing, where this is the normal blood and normally bleeding stops because platelets stick together and start a clot. Whereas whenever there is von Willebrand's disease, platelets do not stick together and there is continuous bleeding and there is no clot formation. So what are the clinical features of it? The characteristic feature of von Willebrand's disease is spontaneous bleeding from mucous membranes and excessive bleeding from wounds. And this is because there is no clot formation. So the three main types of von Willebrand's disease is type 1 disease, type 2 disease and type 3 disease. So type 1 disease is the most common type of von Willebrand's disease, which is characterized by mild to moderate decrease in plasma von Willebrand's factor. That means the decrease is not that much, it is almost mild to moderate, almost 50%, where synthesis of von Willebrand's factor is normal, but the release of its multimers is inhibited. Type 2 disease, it is comparatively less common to type 1 and it is characterized by normal to near normal levels of von Willebrand's factor. And here the von Willebrand's factor is functionally defective, unlike type 1 where only its multimers were inhibited, whereas the synthesis of von Willebrand's factor was normal. Type 3 disease, this is extremely rare and the most severe form of the disease. Patients have no detectable von Willebrand's factor activity at all. Sufficiently low levels of factor VIII is also present. So this is a table showing the differences between the three types of von Willebrand's disease, where the type 1 accounts for 3/4 of the cases and it is quantitative defect. So quantity, that means the number of it is not enough. So there is not enough von Willebrand's factor and it is autosomal dominant. And clinical manifestation is the bleeding is almost none to severe. Type 2 again has its own subtypes, which are 2A, 2B, 2M, and 2N. We're not going much into this. The defect is qualitative in nature, that means the quality of this is defective. So there's dysfunctional von Willebrand's factor. That means the number of it is normal, but their function is not proper. It is autosomal dominant and mostly autosomal dominant, but also sometimes autosomal recessive too. The clinical manifestations are bleeding is almost moderate to severe. And type 3 von Willebrand's disease accounts for less than 5% of cases. As I told you, this is the most less common. And this profound quantitative defect, that is a total or near total absence of von Willebrand's factor. And it is autosomal recessive in nature, unlike the other two types. And the bleeding is very severe. It is almost similar to hemophilia A. So the treatment of it is bleeding episodes of von Willebrand's disease is treated with cryoprecipitates of factor 8 concentrates. So clinical manifestations of von Willebrand's factor. They are prolonged bleeding time, as I've told you, because there is no enough clotting, normal platelet count, reduced plasma von Willebrand's factor concentration, defective platelet aggregation with a few antibiotics, reduced factor 8 activity as well. So these are a few clinical manifestations of von Willebrand's factor. Nosebleeds or mouth bleeding that does not stop within 10 minutes, excessive bleeding from an injury after surgery or delivery, especially dental work mostly, easy bruising or lumpy bruises, heavy or long menstrual bleeding equal to almost 8 days or more than that, bleeding in the joints or muscle. So these are a few clinical manifestations which may look normal to us, but they are generally not normal, and especially the dental work and bleeding in the gums and etc. So thank you so much for listening. I hope this was helpful.